There is a brand new study that's come out. It's stating really what many have been saying for a long time. Basically, that the abortion pill mifepristone is more harmful than what the Food and Drug Administration officially recognizes. And it's actually worse than what many even thought. The study that has been published by the Ethics and Public Policy Center says that adverse effects from mifepristone are 22 times more frequent than what's recognized by the FDA. So how should this change the narrative on the abortion pill? And what kind of action is needed? Well, here to discuss it all is Ryan Anderson, who is the president of the Ethics and Public Policy Center and one of the authors of this study. Ryan, welcome back to Washington Watch.
Thanks for having me. It's a pleasure to be with you.
Well, it is our pleasure to have you, and what a monumental report that you've come out with. So break down, if you would, break down the contents of this study for us. What are the major takeaways?
Sure. I mean, the major takeaway here is that it's a 22 times higher rate of serious adverse events for women who take the chemical abortion drug than what the FDA claims on the label. The FDA claims it's less than 0.5% of women will suffer from a serious adverse event. Real world insurance claim data shows that it's actually 10.93% of women who will suffer with a serious adverse event. Things like sepsis, hemorrhaging, infection, an ER visit, right? These aren't minor things like an upset stomach or diarrhea. Serious adverse events, 22 times higher than what the FDA claims. And this is based on real world data. This isn't based on idealized clinical studies where the drug is administered perfectly. This is how it's really administered in the real world based on 850,000 insurance claims. And then the last thing I'll say is that why do we see such poor outcomes? Both the Obama and the Biden administration got rid of most all of the major safety protections that the FDA originally required when they approved of the pill. So what we're calling on the Trump FDA to do is, for right now, just reinstate those original safety provisions, reinstate doctor office visits, in-office visits, don't allow telehealth, don't allow mail order abortion pills, require physician oversight as a woman takes the abortion pill. Women deserve to know the truth about the abortion pill, and women deserve to have safe, quality health care.
Yeah, when you're talking about 22 times higher adverse, serious consequences, this is no insignificant number. How did the FDA miss it so much? I mean, you just said they took away some of the measuring elements, I guess, of all of it, but still 22 times is an enormous difference. How did this happen when health is supposed to be the central concern?
Sure. I mean, a couple of things to say there. You know, the co-author of the paper is our director of data science at the Ethics and Public Policy Center. And what he discovered is that the original FDA studies, what they did was one study would look at ER visits, one study might look at hemorrhaging, one study might look at sepsis, and then they would add all of those things up together as if all of the studies had looked for all of the serious adverse events. And so there's a numerator denominator problem here. If you're familiar with math, is that the numerator is way too small, and then they inflated the denominator, ending up with a much smaller fraction. Maybe this was politicized. Maybe this was just an honest statistical mistake. One way or the other, they got their math wrong. But then what we saw in the Obama years and now most recently from the Biden administration, it was clearly politicized medicine to get rid of these original safety provisions. It used to require 3 in-person doctor visits when the pill was initially prescribed and dispensed, 3 days later, and then 2 weeks later to make sure that everything was going well. That initial visit to make sure you didn't have an ectopic pregnancy, right? Instead, they're now doing it with online telehealth, mail order abortion pills across state lines. This isn't looking out for the best interest of women, certainly not looking out for the best interest of their unborn children.
Wow. This is stunning information. You actually described this as like a Category 5 hurricane hitting the prevailing narrative of the abortion industry. I think that's a perfect word imagery of it all. But go into more details. What do you mean by that? Why is this such a catastrophic study for the abortion industry?
Sure. I mean, pro-abortion activists say that chemical abortion drugs are as safe as Tylenol. That is not the case. I mean, the most conservatively estimated studies here would be something like 1 in 10,000 patients taking Tylenol will end up with a serious adverse event. Here we have 1 in 10. It's actually closer to 1 in 11. It ends up being 10.9% of women who have this serious adverse event. That's 1 in 9. Sorry, virtually 1 in 9. That's not what we're seeing with Tylenol. This has been politicized. The Obama and Biden administrations didn't act on new data to get rid of safety provisions. They did this simply to make the abortion pill more accessible. What we've also now noticed is that many blue states, pro-choice states, are mailing the abortion pill across state lines. So one of the things that President Trump promised, he promised to make America healthy again. He promised to undo the Biden and Obama era bad regulations and policies. And he promised to leave abortion to the states. Well, you can't leave it to the states if California is mailing abortion pills to the other 49 states. You can't make America healthy again if you have a 10.9% rate of serious adverse events. And you can't undo all the stupid things Biden and Obama did unless you also undo what they did to the abortion bill, right? So that's what we're calling on the Trump FDA to do here. And this just strikes me as both a winner politically, and it's a winner for women's health and for their informed consent.
Excellent information. Ryan Anderson, president of the Ethics and Public Policy Center. Great job. Well done. Hats off to you and your team for doing this work and for getting it out. And as always, thank you for coming on Washington Watch.
Happy to do so.